All right, so what happened to my slides? Okay, good morning, everyone, and welcome to the launch of the WA Falls Report 2023 webinar. My name is Apu Karajagi, and I'm the Injury Prevention Officer at Injury Matters, and I'll be facilitating today's webinar, where we'll be kind of talking about the WA Falls Report statistics and what that means for us who work in the falls prevention space. Before we start, I'd like to acknowledge the traditional custodians of the land on which I am tuning in and facilitating this webinar on, which is the Whadjuk Noongar land, and I want to pay my respects to the elders past, present, as well as the leaders emerging. Australia always was and always will be Aboriginal land. And I'd love to know where everyone else is tuning in from today as well. So if you want to use the chat box to acknowledge the land on which you're tuning in from today, I'd love to know where everyone else is joining if you aren't from WA. I'll go over a few housekeeping points as well before we start. Can everyone just please make sure that your microphones are muted, and this will just allow us to hear the presenters throughout the webinar. If you have any questions, please pop them in the chat box, and we'll have some Q&A time at the end of the presentations and the panel discussion to take them. So just pop them as you think of them, and we'll take them at the end. Also, if you have more than one person in the room with you listening into today's webinar, just let us know by sending us a quick chat message as well, or, about how many people are tuning in, just so that we know how many people are actually tuning into today's webinar. And if you face any technical issues throughout today's webinar, just let us know and we'll do our best to help you as well. Also, this webinar is recorded. So a bit about us at Injury Matters. We work with people and organisations across WA to innovate and deliver injury prevention and recovery solutions. Solutions that keep people safer and healthier at home, at work and on the go. Solutions that save lives and make a community stronger. As a not-for-profit organisation, we work with local communities, industry, government, and our health, emergency and social services partners and to raise awareness of injury risk, prevent injuries, and support the recovery of people impacted by injury. And today's training is through the Stay on Your Feet program with the support of the Department of Health WA. The Stay on Your Feet program provides information, training and support to older adult community members and professionals working with older adults on how to prevent falls in the community. And this is done through the Move, Improve, Remove campaigns. Move your body, improve your health, and remove hazards. Today, we're going to talk about falls in WA. Oh no, what happened to my slides? Sorry. Today we're going to talk about falls in WA, and to give us a bit of a breakdown of the WA Falls Report 2023 and the statistics and what they mean, I'd like to invite Roisin Sweeney, our Research and Evaluation Practice Lead at Injury Matters.
Thank you, Apu. Just switching screens. I'm going to guess that's all good. Cool. All right. Well, thanks for joining us, everyone, this morning. As Apu said, my name is Roisin, for those of you that I have not met before. And over the next 20 minutes or so, I'm just going to talk through some of the key findings from the report that we're officially launching today, the 2023 WA Falls Report. And this is the 5th year of this annual publication. So I'm also going to talk through some of the trends in particular for this year's report. Before I get started, though, I too would like to acknowledge that I'm fortunate to be presenting today on the lands of the Whadjuk Noongar people and give thanks to the elders past, present and emerging from wherever you may be tuning in from around the state this morning. So as Apu mentioned, thanks to ongoing support from the WA Department of Health, Injury Matters collates this annual report to really provide the diverse falls prevention sector with a central document that outlines the latest data regarding the incidence of falls across the state. And within the report, you will locate a suite of different data sets that really unpack what's happening across our state in terms of falls-related injuries, but primarily the data focuses on falls-related fatalities, hospitalisations, and emergency department attendances. And within the report, it breaks down these data sets by a number of different facets, some of which are on the slide at the moment, regarding what population groups are experiencing the highest incidence of falls, what are the key mechanisms for these falls, the nature and diagnosis of the falls, and also to highlight and showcase some local falls prevention activities that are happening across our community. I'm not obviously going to be able to talk about the report in too much detail over the next 15 to 20 minutes. So I do obviously encourage everyone to check out the full report after this webinar to learn about some of these concepts in some more detail. But before we do dive into literally data and statistics, I would like to just take a moment for all of us to remember that every figure that we're going to be talking about within this report and every ultimate person that's attended to hospital or an emergency department or died due to a fall is a member of our community who has had their life impacted. So whether it's the person directly that fell or their loved ones in the community around them, I think it's important that we don't lose sight of this. And although data is integral to us understanding the nature of the issue that we are trying to prevent, we shouldn't lose sight of the fact that ultimately, as a collective in our sector, we're just trying to improve the quality of life of the WA community. All right, so now in terms of the stats themselves, I guess if there's one key finding that you take away from today's webinar or the report in general, or if you're looking for a one-liner that you tell your friends, your families, your colleagues, really anyone that crosses your path, this is a handy one to remember. So the 2023 WA Falls report highlights that in WA, someone dies every 19 hours, is hospitalised every 15 minutes, and it presents to the emergency department every 11 minutes due to a falls-related incident. So really reinforcing the seriousness and frequency of these injuries that are happening in our community. And I'll also note here right at the start that like any data set, we obviously experience some lag in terms of its collection and reporting. So when I'm talking about falls related fatalities this morning, we're talking about the 2020 calendar year. And for hospitalisations and emergency departments, we're talking about the 2021 calendar year. So to start with, to focus in on falls-related fatalities, as you can see in this figure, WA did experience a rapid increase in falls-related fatalities from 2019 to 2020, and this is around a 30% increase. So a huge growth from that we've seen over the previous 4 years prior to this report. And we did do some further analysis of this. So thanks to Anne-Marie and the EPI crew for trying to deep dive into this a bit more for us, because yeah, it was a huge surprise to us at Injury Matters. So we did want to unpack this a bit further. And I obviously didn't come to a great conclusion because we identified that the majority of this increase was in the unspecified falls category, which doesn't give us that clarity in terms of the direct causality of these incidents. But despite this inability, obviously it's a huge issue that we need to prioritise our attention on. And it could be plausible that COVID-19 and the resulted periods of social isolation may have had an impact, particularly because it was the older adult population that accounted for the majority of this spike over the 2019 to 2020 period. And unlike that of falls-related fatalities, you can see on the slide here, falls-related hospitalisations followed an ongoing increasing trend over the last 5 years. So in 2021, we saw there were over 33,000 hospitalisations in WA, which equates to 1,070 hospitalisations per 100,000 people, which is that figure you can see on the right-hand side of the graph there. And the most common point of entry into hospital for these individuals was via an emergency department, but this was followed by non-waitlist elective hospitalisations also. In regards to their residents prior to hospitalisation, 77% of patients resided in their own home, and this was followed by 23% at a different acute hospital. But of particular interest in this space, and I know there's a couple of aged care workers joining us as well this morning, 2,307 falls patients who did not previously reside in an aged care home prior to their hospitalisation were discharged to an aged care facility upon exiting the hospital. So again, placing additional burden on resources provided to our older adult community. And then finally on the slide there, you can see on average, individuals spent 7.7 days on hospital per admission. And this equates to over 255,000 hospitalisations and an estimated $310 million in terms of those associated healthcare costs. And the final piece of the puzzle is around emergency department attendances. So as you can see, falls-related ED attendances did increase, similar to that of hospitalisations from 2020 to 2021, and there were over 47,000 ED attendances during that calendar year. The majority of the individuals who did attend the ED due to a falls incident presented via private transport, but 23% did also present via an ambulance. And in regards to the severity of these presentations, 54% were assigned a triage category of semi-urgent, which means they required care within 60 minutes, and 35% as urgent, meaning they required care within 30 minutes. And over the next few slides now, I'm just going to break down some of this data in terms of who we're talking about, what's the demographic and the population groups that this data is mostly attributed to. To start with here, you can see the gender breakdown across the three measures, and males and females did experience different incidents of falls depending on what metric was being used. So on the table, you can see that in 2020, males experienced the highest number and rate of falls-related fatalities, and this matches the ongoing trend in terms of males having this heightened representation within fatality data sets. But in 2021, unlike that of previous years, males also experienced the highest rate of hospitalisations. But females did continue to experience the highest number of hospitalisations and the rate and number of emergency department attendances. So I'm sure it's no surprise to everyone that falls can happen at any age. We all know that, but falls are most common in amongst our older adult population. And as you can see on this graph here, the figure of falls related hospitalisations and ED attendances were highest amongst individuals aged 85 years and over. So the right hand side of your graph there in front of you. So this is during the 2021 calendar year. But it's important that we also don't neglect the fact that there is a high rate of emergency department attendances amongst our children, which you can see via the teal to the left-hand side of your figure just there. In regards to our older adults, though, of additional concern in terms of the rate of these presentations is the fact that our older adults do stay in hospital longer when they are admitted due to a falls-related presentation. So they experience an average length of stay of 9.1 days, so a significant period of time they're spending in hospital following these incidents. Again, further reinforcing the harm that falls are having on our community. And not included in this graph due to obviously the significant difference in its count, but falls-related fatalities also did increase across the lifespan, with over half accounting for our older adult population aged 85 years and over. And I guess somewhat given that, as I pre-mentioned, this webinar is delivered thanks to our Stay on Your Feet program and the large amount of people in this room that do work within the allied health space, that I'm sure the majority of you are aware the burden that falls does have on our older adult community and also our healthcare system as a result. But further reinforcing this, as you can see, there's some highly concerning statistics within the report regarding injuries amongst our older adult community, including a 35% increase in the number of older adults being hospitalised due to falls over the last 5 years. And this is just some of the reasons why this annual publication and the annual analysis of the data is really valuable, as it enables us to monitor the incidence of falls and provide additional evidence for the need to further support our older adult community to reduce their risk of having a fall, especially given our ageing population here in Western Australia. And unfortunately, falls did remain a key health issue impacting our Aboriginal people in WA within this year's report as well, with 8 individuals dying in 2020 and over 1,500 individuals being hospitalised and attending an emergency department in 2021 due to a falls-related incident. And In WA, we know that Aboriginal peoples represent approximately 3.3% of our community, and therefore by accounting for 4.7% of all falls-related hospitalisations, this is a particular concern to the health and ongoing wellbeing of our Aboriginal community. Within the report itself, when you get your hands on it in a couple of minutes, you'll also find a number of breakdowns regarding the location of falls-related incidents. And as evident on this map on the right-hand side, you can see the rate of falls-related hospitalisations did vary across health regions in 2021. Some of this variance was fairly minor, such as that within the metro health regions. But if we look up at the Kimberley, they experienced a hospitalisation rate 136% higher than the state average in 2021. And this is an ongoing trend in terms of that burden placed on our regional community members. In regards to where specifically these falls-related hospitalisations do occur, over half of them occur within the home or an aged care facility, which is similar to that we've experienced over the last 5 years. And within the home specifically, the falls commonly occurred in outdoor areas, the bathroom and the bedroom. So again, frequently accessed areas within the home. Also on the table on your left, you can see that other leading places included a health service area, a residential institute, and public pathways. So the core concepts I've touched base so far on are primarily within the EPIS data set, but the report also includes some additional data regarding falls within residential aged care services and workplaces. And I'm sure as many people are aware, it's now a requirement for all Australian government subsidised residential aged care facilities to report falls as part of a suite of different quality indicators that they collect. And the data within the report highlights that on average 35% of aged care eligible recipients in Western Australia experience one or more falls, of which overall 2.3% were that of a major injury. So this could be things such as a bone fracture, for example. And similar to that of varying locations in terms of the incidence of falls, we know that there's different settings can have a different influence on people's falls risk, and one of which is workplaces and the different hazards that may be attributed to that setting. And as a result, the report does highlight different data set regarding workers' compensation claims during 2021 in regarding to lost time at work due to falls. And overall, falls accounted for 26% of all lost time claims during the 2021 calendar year. So a huge proportion of that workforce burden is due to falls related injuries. And like any data set, I guess there are challenges in terms of unpacking it. So unfortunately, in terms of the causes of hospitalisations, this is only representative of 79% of all hospitalisations, but it does still tell us a story. So as you can see, the majority of falls related hospitalisations resulted from either a fall on the same level, a fall from an object on the same level, or a fall from some steps or a bed. So probably not surprising for those of us working in the fall sector that these are the leading causes of the hospitalisation. But interestingly, the causality did vary by age group. So amongst that older adult cohort, fall-related hospitalisations generally occurred from a fall on the same level, accounting for about a third of all presentations, whilst in children, the leading cause was that of playground equipment. So we can see different causes of the incident itself and therefore the resulting injury also. Also within the report, you can see there's different average lengths of stay attributed to different causes of these hospitalisations, and generally falls that involved some kind of assistive equipment had the longest average length of stay in hospital. And finally, another causality that we unpack within the report is that of alcohol-related harm. And this year's data indicates that 7% of patients had consumed alcohol prior to their admission. But this week, there's been some new research out from Victoria regarding the presentation of alcohol in their hospitalisations. And it did show that approximately 25 to 30% of their trauma admissions patients did have alcohol present. So it does suggest that there is some underreporting and undercounting within this 7% in Western Australia. And again, there's lots of clinicians in attendance. I'm sure none of this is a surprise, but it's still nice to have it quantified within this report that over half of all falls-related hospital, like almost half, sorry, 49.7%, did result in a fracture. So the person presenting to hospital did require some treatment due to a fracture. And in regards to where these injuries were occurring, the majority were in the lower limbs, but injuries also occurred in the upper limbs and to the head and neck. And as we know, individuals don't only seek treatment due to falls related injury within the hospital setting, they also seek treatment from different healthcare services. So within the report, there is some breakdown regarding health expenditure and different payments that are made to different health services. And this was during the 2019 to 2020 financial year. And not surprisingly, at the top of the table there, we can see that public and private hospitals contributed to the greatest expenditure, but you can see there was also expenditures made regarding dental services, GPs, medical imagery, PBS, etc. So lots of different health services are accessed as a result of a falls-related injury. As I briefly mentioned at the start, alongside a lot more comprehensive data, obviously within the report also includes some case studies regarding falls prevention activities that are happening in the community. And this year's report showcases three really highly successful and sustainable programs being run by the City of Almondale, the City of Albany, and Umbrella Multicultural Community Care. So when you do access the report, I really encourage you to have a look at these case studies and see how you can potentially apply some of their learnings into the local activities that you are running in the community. Alongside these three organisations who did provide case studies for the report, I would also like to acknowledge and thank all those data custodians and in particular WA Department of Health's EPI team. The report would not be possible without all of these external collaborations. So yeah, again, thank you to everyone who's involved in making this report possible every year. So what's next, or I guess where to from here? As I mentioned, this is really a short overview of what is within the report, and therefore I do encourage everyone to have a read of the report now that it's officially launched and available on our website. But equally important, we really encourage everyone to share the report through your networks on social media to help raise awareness of the important issues that we're all working to address. Because I mentioned at the start, the figures are one thing, but there's a bigger story to be told beyond the numbers that are present within this report. And the work really does only start now. As I mentioned throughout the report, there's a number of concerning trends, particularly regarding our older adult population. So it's really important that we use this report as an advocacy tool to highlight the need for additional falls prevention activities happening to further support our community and enable our health professionals to support them as well along the way. So to help facilitate this within the report, we have identified and outlined a number of recommendations to address some of the high risk issues identified within the data. And at Injury Matters, I guess we will continue to champion and advocate for the need for these changes, but we'd also welcome everyone else to do the same. And I won't touch on these too much because some of our panel members are going to discuss some of the concepts in a bit more detail. But as you can see, the recommendations draw attention to various different needs within falls prevention as an overall sector. So things like how can we apply proven falls prevention initiatives to support our high risk population groups, making strength and balance exercises and classes more accessible to our older adult members of the community, because we know this is a key way that we can reduce individuals' risk of having a fall. Rolling out and implementing the Ironbark program on a long-term basis here in Western Australia, and also touching on those alcohol-related harm. How can we reduce this incidence by rolling out additional legislative measures to reduce alcohol-related harms as a collective within Western Australia? And then finally, some recommendations there regarding further supporting our health professionals in terms of the systems that they're operating in and their skills to identify and refer individuals on who are at high risk of experiencing a fall. So that's all from me this morning. Please don't hesitate to reach out if anyone has interest in being involved in future editions of the report, or if you want to get involved in some of our advocacy activities regarding falls prevention, do definitely reach out. But if anyone has any questions, please pop them in the chat. Or otherwise, after you've read the report, yeah, please don't hesitate to get in contact if you have any further questions regarding the data that's within the full publication.
All right, we'll take questions now. If anyone has any for Roisin about the Falls report or anything that Roisin went over in her presentation. As you can see, the Falls report is available now on our website, so people can go in and have a look and read a bit more in detail about what Roisin just broke down in her presentation. We'll just wait a bit longer and then I'm sure there's questions. All right. Miriam asks, do we know if these trends are also being seen in other states?
Yeah, great question. We are fortunate in WA to be able to do this local publication. Other states don't have a similar publication made, but in terms of that national data set, WA does have some abnormalities in terms of the data regarding fatalities. That spike wasn't experienced in other states during that calendar year, but in terms of hospitalizations, yeah, the trends are similar with the aging population across the country.
Cool. Okay. Well, Roisin will stay on for a bit longer as well. So if there's any questions that pop up, just put them in the chat and we'll take that a bit later as well. We will start with the panel discussion. So joining us today for the panel discussion, Tony, there's a bit of a echo. Sorry. Joining the panel discussion today is Professor Anne-Marie Hill from UWA. So Anne-Marie Hill is a Senior Principal Research Fellow. Hi, Anne-Marie. Thank you for joining. We also have Samantha Menezes. So Samantha is the General Manager of Injury Prevention at Injury Matters. And Tony Pedder, who is the Senior Falls Physiotherapist at Sir Charles Gardner Osborne Park Healthcare Group. All right, so thank you and welcome all for the panel discussion. So I have a couple of questions I have prepared for you guys, and I'd love to know your perspectives on it. So the Falls report recommends that subsidized classes are needed to make it affordable for older adults to participate in balance and exercise classes, that is one of the main barriers for older adults. Tony, this is for you. What do you see as the biggest barrier for older adults to participate in exercise?
I think you probably need to look at it from two perspectives. What are those intrinsic barriers that might restrict somebody wanting to participate in an exercise class? So they may have the perception that maybe they're too old and exercises are not going to be of any value to them. There might be a knowledge deficit there related to the perspective of fall. So they might have had a fall. They might not know that actually strength and balance exercises are a key intervention to try to help and reduce the effects of those falls going forward, and that they might actually be able to get some benefit from them. They might have some fear of falling, which might restrict their ability to want to participate. So they might be less likely to want to go outside of the home. So their ability to access a class may therefore be limited more through their confidence. So they don't feel, happy with maybe a family member or helping them to get to a class or going out by themselves. They might be a little bit concerned about exercising in general. So they might have a heart condition. Is it going to be safe for my heart? I've got bad pain in my back. Is it going to be make my back pain worse? So just those things around the internal drivers which might actually limit somebody wanting to participate. The frailer an older person gets, then they might have less energy and be more lethargic, and then their drive to actually try to exercise can be more difficult, even though we know that it can get benefits. So there's those kind of like internal things. Externally, there's always the barriers that we always think around. Is there a class in my area? Can I access it? I might not be able to drive anymore, so can I use public transport? If I can't use public transport, can I catch an Uber or a taxi? But then that can get quite expensive. So there's the cost of transport to access a class. also obviously the location of the class, but also within that is the class at a level that's going to be appropriate for my abilities. So you might have somebody who's quite frail, so they need an exercise class which is going to necessarily meet their capabilities at that point, as opposed to somebody who's a little bit more independent, and they might be able to undertake a class which is actually a little bit of a higher level. So even within whether a class is available or not, is the actual class going to be appropriate for that client at that time? So they're just some of the issues, I think, and it's not going to be barriers for all people, but certainly some things which might actually affect somebody's ability to actually access a class if there's one available.
That's good to know. Well, I guess with how complex the issue is, does anyone, and this is to all panel members, do you guys have any suggestions for any solutions to address any of those issues? And is there anything that has worked previously, or yeah, any kind of suggestions for solutions for those?
I'll just say a few things and maybe can go to the other panel members. I think we need to probably make sure that we look at what's existing in the community already and see if we can expand some of those services. I'm sure, some of the services like community physio, for instance, would love an extra $1 million to be able to roll out more classes in wider areas, so that, they can meet greater demand and actually facilitate more demand, because we know there's going to be more classes. But also maybe looking at what's already existing in the private sector and seeing how those classes are able to expand, maybe through some government funding to support these private classes if they meet certain criteria in terms of meeting falls and balance guidelines around exercise, in terms of delivering that. If we looked at a falls class nirvana, so what would be the ideal? I think almost in every location there would be an area where we could conduct exercise classes, and they might run during the day for 3 or 4 hours, and people can come in at different times and maybe for different levels. I think obviously the challenges there are also maybe in rural and regional areas, maybe even more of an issue in terms of people living more remotely and being able to access classes. So then if we had classes in more central locations, do we have good telehealth options and being able to provide online access to classes for people who can't physically access the class, and having sure that that technology is easily accessible? So it'd be like some kinds of things that I think would work well. Maybe having different clinicians work together in terms of classes. So you might have a physio or an exercise physiologist working with somebody who's Cert 3 trained and able to deliver a class, so that you can actually match the different abilities of people attending that class and working together. So you might be able to manage in single class people who have got higher risk and maybe need more input from somebody who's got a high level of skill in terms of exercise prescription around falls, and then the rest of the class might be able to be controlled by one of the other staff members there. So just some differing ideas.
Sam and Anne-Marie, did you guys have anything to add?
I'm just waiting for Anne-Marie. I'm wondering if she does first, because I do, but I thought I'd let you go first, Anne-Marie.
Oh, okay. Thanks, Sam, and thanks, Tony, for, I think the suggestions you've made there are really good. I do think it is important that we start advocating very strongly and achieve a national approach. So I would, although I'm very keen for us also to use real neighbourhood community solutions, I think that we all do need to strongly band together now as much as we can across every sector and really bring this forward to the government, because in 2018, the national report shows we spent $4.3 billion treating injuries due to falls. So $4.3 billion. So that's going to rise every year, where that's going to increase if we don't do something. So we really do need, I think, some government support to roll out a more systematic approach if we're going to achieve a reduction. And I guess I would echo the really cognizant comments of Injury Matters that let's remember that every injury is a person. every time this happens, some person leaves their place of work to go and help their mother who's been admitted to hospital with a fall, and that person can't pick up their children from school. And every time someone injures themselves, if they're a grandparent who normally does pick up their grandchild, they can't do that. So, I think the government really needs to look at that with us promoting that. I think that it is really important to emphasise, I thought it was very telling, the sharp increase as people get older and the sharp increase in the incidence of falls as people get into their 80s, 70s, late 70s, 80s, 90s. In WA, we particularly have that older population now of centenarians as well, as increasing numbers of people in their 90s. There is, I think, a very big dearth of programs and not a strong realisation that the most benefit you can often make in falls prevention is actually working with some older, frailer people who may need a more tailored program. And there I agree with Tony. And I think that we need to really provide a broad range of programs, again, as Tony suggested, and I'd like to see more embedded into normal programs that are operating. For instance, we know that every week many community centres have seniors meetings and have active community older age groups. I think that they should be given some funding to run a regular strength and balance program for a vast number of people that attend those groups. And we also need more online programs for people who might not be able to leave their home. And with our aged care support workers, I definitely think as people are coming into the home to help people with some gardening or some shopping, this is where we need that advocacy to suggest that these aged care carers, it would be great if they were routinely also promoting and helping that older person to do their exercises. It really, I think, needs to be a routine. I'm going to make you a cup of tea. Let's also do your balance exercises. Those are ways I think we can value add very importantly. But I do think that advocacy, so we can build up a systematic approach and use that preventive approach to getting more older people into falls prevention programs is really, really key at this stage.
Yeah, I'd just like to add to both of you, definitely a comprehensive approach across, I guess, different needs of the population. But for me, it's also definitely that community-led prevention approach around, I guess, the role of local governments and understanding what's already happening in the area, as you've already suggested, and then organisations like Injury Matters providing the data to them to say, look, this is what's happening in your local government area around falls. So it's helping them see the issue and helping them lead opportunities where falls prevention activities can happen. So there could be some facilities that maybe can be used and then bringing in programs that are already happening. So your existing aged care connection groups, because I think it's also about that community connection as well. And so getting people to want to go out to these groups to build that community connection. And while you're there, you're also learning some key strategies around healthy aging, falls prevention, and so on. So you do have some really good takeaways when you leave, but you also have some strategies you can implement at home and that you can do together with your group of friends that you're sort of coming together with. But I really do see it as a community-led approach is really important, as well as the government approach around funding and identifying that communities need this support to be able to get these things off the ground. But more importantly is looking at what's already happening and then supplementing that as well.
I think just want to maybe to add on to that is, I think obviously the focus is on falls and the importance, obviously, from a strength and balance. I think maybe what we need to be doing as well is maybe partnering with other organisations such as around cardiovascular health, diabetes health, or also promoting kind of like the importance of physical activity and exercise, and actually seeing, we know that exercise is a wonderful kind of like, medicine and tool for treating so many conditions, including obviously trying to prevent falls. And if we can get like better buy-in because we're going with a multifaceted approach in terms of actually trying to promote the importance of physical activity and structured exercise for a variety of conditions for our older adults. And maybe that might help in terms of getting the government to provide some extra funding for developing programs and to trying to roll out programs in the community.
Some great points. Thank you, guys. And thank you all for, sorry, Anne-Marie, did you want to say something? You're on mute.
Oh, you're muted.
Thanks, Alpha. I just wanted to really affirm what Tony and Sam have said there. And I think we should join with groups such as Seniors Australia, COTA, to encourage that advocacy approach so we can systematically get more falls prevention / healthy aging happening. And I do think I'd like to just have a plug and say, let's not leave anyone behind, because if you have more disposable income, it can be easier to find and access those programs. And so we do need to make sure that there's that public health approach so that people are, regardless of age, location, any other factor, can have good access to high quality programs.
Yeah. Thank you, Anne-Marie. So thank you all for also adding to the conversation by putting your thoughts and questions in the chat. We'll take that at the end as well. And just to also state that we had a fourth panel member, Margaret Gitchup, but she couldn't join us today as well. So I have another question, and this is to Sam. Sam, the report also states that older adults are likely to consume alcohol in quantities exceeding lifetime risk guidelines and drink daily than the general population. With your knowledge of alcohol and other drugs, as well as working in the injury prevention space, what do you think can be done in this space to reduce alcohol-related harms in WA among the older adult population?
Oh, thanks, Apu. I thought I'd just approach this question with our report recommendations. So I was going to go through just quickly around the effect of alcohol on our older population and some of the key strategies we can do that align to what we know works. So essentially, I think, look, everyone in the room knows the effect on judgment, coordination, and concentration that alcohol consumption can have, and it is a key risk factor for increasing an individual's risk of a fall. We know that our older adult population can experience greater risk from alcohol use due to the just natural age-related changes in their body composition, including a lower volume of body water and lean body mass. And these are contributing factors that are particularly influential on an older adult's risk of experiencing an alcohol-related fall. We know that the latest National Drug Strategy Household Survey results indicated that older adults are more likely to consume alcohol in quantities that are exceeding lifetime risk guidelines and drink daily, a little bit more than the general population in some instances. So Injury Matters, we support the need for additional action to be taken to reduce alcohol-related harms in WA, and this includes strategies that manage availability, price, and promotion. So when we address all of those three areas, we're reducing the opportunity for availability, promotion, and pricing contributing to risky drinking. So for us, this includes the introduction of a minimum price for alcohol set at a level informed by evidence. So set at $1.50 per standard drink and regularly adjusting this for inflation as part of a comprehensive approach to minimising harm from alcohol. And number two, tightening regulations on the marketing and sale, which includes online of alcohol products. For example, online delivery. We are hearing time and time again from Allied Health that they could be in the home working with an older adult and an alcohol delivery will turn up on the doorstep, or it might be just in on the bench having recently arrived. So we're aware that the availability and the ease of getting alcohol is becoming much easier for people across the population, but particularly for our older adults who may not be getting out and about as normal and can't just sort of go or feel it's easier to just get the online delivery rather than walk down to the shop and grab some alcohol. So that is of huge concern. I think the other side of things to look at is how we work as a sector to promote our healthier communities. And for Injury Matters, we're really quite invested in workforce development activities that build the confidence of our health professionals to identify and address harmful alcohol use among older adults. And importantly, this will really improve the understanding and awareness of alcohol-related harms in our community and where people can be referred to for support. So that's just some key, some points that I wanted to sort of use to answer this question today, Apu.
Thanks, Sam. That was a great answer. There's so much we can do in that space, and I feel like it's going to be a slow but steady advocacy area that we all can pitch in and do more in. Anne-Marie, I have a question for you. What support do you think is required from the falls prevention sector in residential aged care settings?
I think that there is significant more input required. We know that older people who live in aged care are very likely to fall. And yet we do have good evidence that even people who are very frail can reduce their falls risk by completing the exercises at a level that they can do. And we also know that there are many people, majority of people who live in aged care will have dementia. And we know there are good strategies to work with people with dementia to reduce their falls risk. So there needs to be more input into residential aged care. And I think that the changing government practice and the new aged care funding models are important to try to drive a more rehabilitative focus in residential aged care. And I'm not meaning necessarily rehabilitation from an acute injury, but rather than a focus of let's just let the person live there, there needs to be a focus on let's help every person maintain and even improve their ability when they're there. So that the residential aged care setting is a place of positivity and as much growth for that older person as possible in their circumstances. So certainly we need more training. I do think that for aged care workers in residential aged care, the training needs to be more augmented. And I do think we need more health professional input there. The government's recent move to include pharmacy as a much more strong primary provider directly into aged care is an indication of how they've recognised that the medications and people being on perhaps medications that deteriorate their health is such an important problem in residential aged care. And so are the falls. So I think that, again, we're really going to need some government support for us to get some of the action that's required in residential aged care to make sure that those older people are not being left behind.
Thank you for that, Anne-Marie. I will take some questions from the audience. So some people have asked a couple of questions in the chat, so I'm just going to facilitate those. Miriam asked, does anyone have experience using specific apps or online programs that they feel are of good value and quality that they can share with the wider audience?
Could I just share briefly, Apu, that when COVID commenced, a group of physiotherapists, myself included, started this safe exercise online program, which is a free program for all health professionals and for older people. And it includes access to exercise, free exercise sheets and handouts, advice, information. So, and that website is endorsed by the Australian Physiotherapy Association, and we maintain it and monitor it. And we also have now an increasing number of handouts that are in other languages for people from other cultural backgrounds. I would also comment that the, thank you, Joanna, I can see you've just put that up there, the link already. And I do think that the Injury Matters website is perhaps for WA a naturally it's already a very informative and good website, and I do think we could use that as a conduit to expand some of the things that are available online there for older people, perhaps more interactive, monthly exercise sessions online for a while, or, different activities. It's just so well set up, and if the person logs into it, the older adult or the health professional, the whole suite of resources is there. So maybe making that Injury Matters website a more active process for everyone in WA as a stopping point for a once a month, linking with your already existing community of practices. I feel that could be of real benefit for us in WA.
Thanks, Anne-Marie. There's a bit of work that's been done on kind of like online exercise programs. So there's some studies that have come out of New South Wales. I think it's Standing Tall, I think might be the latest one that's been going for a couple of years now, and I'm not sure whether they're quite actually finished that, but that's an online delivery through like an iPad. So that isn't quite available, I think, yet for the wider population, but that looks like that would be quite a promising program based on their results. And I mean, there's some smaller apps which are out there, which work on like some fundamental kind of like little exercises or like stepping reactions. So there's one which is called Clock Yourself. It's quite a cheap app, and that involves a range of stepping reaction exercises. There are some which seem to be more available like internationally and not necessarily ones that we can use here, but there certainly are a few things, and I think it'd be interesting to see how the one out of New South Wales will develop, because that was quite a large research trial that's been conducted.
Thank you, Tony. Tony, actually, there's a question for you from Chelsea. She was hoping to know whether there are any cross-facility or hospital falls prevention groups or collaboration to identify personnel who may have been subject to previous falls to further assist and identify patients who may be at a higher risk of falls for when they go back into the community.
I did see this question. I was trying to work out how to respond because it's quite a bit there to unpack. I think maybe what Chelsea's asking is whether, obviously, when they attend with St. John's, whether they're more easily able to attend people who've already participated. We don't kind of like have a central repository of people who've attended kind of like fall prevention programs, certainly through the public system. Probably the easiest way is, depending on where that person lives, is maybe touching base with the local tertiary centre and maybe the aged care unit or the physiotherapy department, or probably the aged care unit, in terms of looking at whether that client is potentially known to that service, whether there's maybe been a previous referral. Certainly, I think if the person can be easily referred in, and we'd be happy to see them if they've already been seen recently, well, then that's just another referral, which it'll continue. But yeah, we don't really have the person is recorded on our central systems, but it's not like a database which is kind of like widely spread in terms of highlighting who's attended and who hasn't. If that's not what Chelsea's asking, I'm quite happy for her to email me afterwards, and happy to chat to see if I've got a better response.
And yeah, we'll share contact details of all the panel members if anyone wants to reach out and have a chat and discuss any aspects a bit more as well. All right, thank you. That was all for questions. There's some great comments there around what's been happening in the community and what's been working and what hasn't. Injury Matters do have a range of online resources as well. So we do have resources for older adults. We have an online learning module to raise awareness around falls prevention, both for community older adults as well as health professionals, to just try and raise our awareness around why falls is a great issue in the community and what health professionals can do in that space as well. We discussed some great points, and I just want to summarize before I finish off this webinar. So some of the key recommendations that the Falls Report 2023 has stated is that we should be providing affordable and accessible exercise classes for older adults. So some of the key barriers are obviously cost, but also just fear of falling again, frailty, as well as cost of transport to get to places. And some of the things we talked about as a panel in terms of suggestions for solutions that we can all be implementing in our community is working together, having a range of different health professionals leading those exercise classes, as well as having them subsidized by hopefully having more government funding, as well as having a broad range of programs and embedding them into existing programs that are already funded. As well as online programs that are a great way to raise awareness as well as understanding of why strength and balance is important, and having exercise classes in central locations for people to get there easier. In terms of reducing alcohol-related harms and how we can do a bit more in that space in terms of advocacy. Sam said that availability, price, and promotion are one of the key things that we should be addressing in terms of alcohol access and its link to falls in older adults. So introducing minimum price for alcohol, as well as tightening regulation for alcohol access, and building confidence in health professionals as well to raise awareness and support to reduce alcohol-related harms and therefore falls in WA. And Anne-Marie stated that the support required from the falls prevention sector in residential aged care settings. We need more input from health professionals, as well as government support to better, I guess, make residential aged care settings a bit more falls friendly, as well as maintain and improve health of the older adult clients as well that are already in residential aged care, as well as more training for aged care workers. Are there any other points that the panel discussion wanted to raise?
I just popped a comment on the chat, Apu, just really reinforcing local government as a key stakeholder, and even being able to get falls prevention in their strategic and community-based planning. It's really important because then that just gives them the ability to be able to roll out these types of things and support existing and ongoing programs. So, and also even opportunities to pilot, actually, I think is really important. So going to a local government area that's already proactive, understanding what are they doing and what can an organisation like Injury Matters or other key stakeholders do collectively to support them to do more sustainable prevention programs, and even increasing capacity for simple evaluation as well of what they're doing so they understand what's working and what isn't working.
Thank you, Sam. Anne-Marie, did you have any last thoughts?
I do think that it's also important as health professionals that we take that broad brush view of promoting healthy aging. And whilst we have talked a lot about strength and balance, things like harms from alcohol, things like vision, things like shoes, they bring in all health professionals really. There's not one health professional or health profession that I think can't be advocating for falls. So GPs, specialists, eye care practitioners, podiatrists, these are all groups, pharmacists, chemists, these are all groups that can be advocating about falls prevention right now. So I think Injury Matters is definitely has the right focus in trying to upskill and increase those people's advocacy and involvement. Every time any health professional sees an older person, some of the language of healthy aging and falls prevention needs to emerge from us, I think. I think that's a really important thing.
And Tony, did you have any last words that you wanted to share with everyone?
No, not really. Just echoing what Sam and Anne-Marie have already said, that it needs to be a really collaborative approach.
Well, thank you guys, Tony, Anne-Marie, and Sam, for your time and your expertise and sharing your thoughts. And thank you for being part of today's panel discussion. And thank you, Rasheen, as well, for the breakdown of the WA Falls Report 2023, which is now available on our website. We also want to raise awareness around our Move Your Body grants that we have open at the moment. So if you have an idea for to raise awareness around to build strength and balance to prevent falls and promote healthy aging within older adults in your community, we have a Move Your Body grant applications now open, and they close on Friday, 27th of October. You can read more about it on our website as well. So I think that just hones in how much we talked about strength and balance exercises, and there are so many barriers that we can think of, and obviously there are solutions out there. So we'd love for you to apply for our grants and actually use those solutions in your community. And also, yeah, just I'm going to wrap up by saying thank you. And we want to hear about what you thought about today's webinar as well. So there'll be an evaluation link shared in the chat box. We'd love to hear what you thought about today's webinar. So please do fill out that very quick survey. And thank you all for being part of today's webinar, tuning in and taking your time to learn more about falls in WA. Thank you.